This is a head-to-toe assessment. I'm going to start by introducing myself to the patient. You always want to perform hand hygiene, provide for privacy, make sure they're comfortable, make sure they understand what you're about to do, how long it's going to take, what is expected of them. So I'll start by talking to the patient, and while I'm doing that, I'm observing how she looks, so I can gather some psychosocial data from that. What's her affect like? Is she tearful? Is she hyperverbal? Does she seem depressed? Does she seem happy? And I'm looking at her general overall picture of health. So does she seem emaciated? Does she seem dirty? Does she seem disheveled? And then I'll move on to determining her orientation status. So I'll ask her, what day is it today, Sade? Sunday, okay. And what is the date, do you know?
The 18th.
Yep, and what is the month?
February.
Who is the President of the United States right now?
Obama.
What city are we in?
Detroit.
And what's your full name and date of birth?
Sade Williams, 9/21/92.
Okay, and you can also ask, where they are, what brought them here. So Sade is oriented ×4. I can also give her a little memory test by asking her to memorize 3 words. So I'm going to give you 3 words to remember. I'm going to ask you later, okay? So baseball, airplane, and grass. Can you repeat those for me?
Baseball, airplane, and grass.
Okay, and I'll ask you those a little later in the exam. And with that, we can judge her short-term memory. So I'll move on from there to testing muscle strength. So I'm going to put my hand next to Shade's face and ask you to push against my force, okay? And the other side, and forward, and backward, all right? And put your hands up like this, pull them towards you, red, and push them towards me, yep. Okay, and squeeze my fingers, both sides, hard, and release, okay? And push your legs out, okay? And pull them back towards you. Lift your knees up, and shrug your shoulders. All right. So we can see that her muscle strength is 5 out of 5. No issues there. I'm gonna move from there to testing her dermatones. So I have something soft and something hard or sharp. I'm going to ask her to close her eyes and tell me as I touch her 4 limbs what she feels, soft or hard, and where it is.
Soft.
And where is it?
On my knee.
Which knee?
Left.
Okay.
Sharp on my right ankle.
Okay.
Soft on my right shin calf. Sharp on my left ankle.
All right.
Sharp on my right arm. Soft on my right wrist. Sharp on my left forearm. Soft on my left shoulder.
Okay. And obviously your patient could be dressed in a gown. You can ask them to undress as necessary. When you're dealing with as a male, dealing with a female patient, depending on what you need to do, you may want another female practitioner or a nurse, someone in the room for safety. I'm going to move on from that to asking, we're going to do a test of the deep tendon reflexes. Now I had uploaded a video of just deep tendon reflexes. We're going to do them here again quickly. So I will start with, can you take this off, is that all right? We're going to start with the first one on the bicep, putting my thumb in the antecubital area. We give it a quick strike. You can see that the hand should jump And we can do the same on the other side, testing the cranial nerve 5. All right, and moving on to the tricep, cranial nerve 6. And you should see the arm jerk out just like it did. Do the same on both sides. And moving on to the radial. This one's a little harder to find, but the arm should supinate. And we're gonna move on to, that again is cranial nerve 5. We're gonna move on to the knee here, and you should see the legs jerk out for cranial nerve L4. And then to the Achilles, where you should be able to see a dorsal movement of the foot. And then finally, checking for the Babinski reflex. So I pick her leg up, and with the other end of my reflex hammer, running my hammer across and up and down her foot. On a small child, the foot should, the finger should, toes rather, should splay, and the foot should go back. On an adult, you should see the foot actually move forward, which it did. I'm going to move from there to looking at Sade's station and gait. So I'm going to have you stand up, Sade. And just close your eyes for a moment. You can see that she can stand perfectly upright. She's not leaning to one side. And open your eyes. If you could just walk out for me in a straight line. Okay, good. And then walk back just on your heels.
Like this. Like this.
Yep. And turn around and walk on your toes. Good. And now walk back to me heel to toe.
Out.
Yep. And she is able to do all of those tasks without falling over, without wobbling. You can go ahead and hop back up. We're going to move from there to looking at her head. So on the cranial nerve video I uploaded, we looked at Perla, which is looking that her pupils are equal, round, reactive to light, and accommodate. So I'll sort of go over that quickly, but we can see that her pupils dilate with the light, and that when you shine the light in one, the pupil of the other eye also dilates. We're looking for any drainage, any injury, redness. Can I remove your glasses here? You can gently pull the conjunctiva down, look and see that that is moist and pink, see if there's any extra redness. I'm looking at the scleras, noticing that they are nice and clear and white. And I can go from there to looking at the nose, and again seeing that mucous membranes look moist and pink. There's no excess drainage, that the septum is midline. Looking at her mouth, you can open and say ah. Again, mucous membranes nice and pink and moist. There's no drainage coming from the ears. No lesions, no areas where the skin is not intact. If you can turn your head that way, I can look at her jugular vein. I'm noticing that there's no what we call JVD, jugular vein distension. Go ahead and look the other way. Again, I'm looking at the same thing. And then you can palpate for the carotid arteries. You want to make sure you do these one at a time, never occlude both carotid arteries at the same time. A person can faint that way, fall out that way from lack of blood flow to the head. So I'm feeling that her carotid artery is nice and strong, steady bilaterally. And I can also listen with my bell to her carotid artery. And I'm listening for bruits, which you don't want to hear, and I'm not hearing those. Moving on from there to her chest, we're looking at the respiratory system. I'm going to start by palpating, and I can feel now for crepitus, which I'm not feeling. That would be kind of like a crackling under the skin. I am not feeling any vibrations. I'm also looking at her, noticing that she's not in a tripod position. There's no retractions. It doesn't look like she's using accessory muscles. She's not struggling to breathe. Again, palpating on the back. I can palpate 6 positions here and 4 on the back. 4 on the front. And moving from palpation to auscultation. So I'm going to be listening with my diaphragm to 6 positions on the front, 8 on the back, and then I'm going to listen to the flanks on both sides, 2 on the left and 3 on the right, due to the number of lobes on the left versus the right. So on the front, you usually want to go start above the clavicle, and you're going to go over, down, over, kind of zigzagging back and forth like that. We're going to listen to 8 positions on the back, and I'm having her breathe, take nice deep breaths in and out. Make sure you have your stethoscope in correctly. And then if you want to lift your arms up. And I should have started on the right there, that way you can go back and forth and end on the right. But basically when I'm listening to her lungs, I'm listening for any adventitious lung sounds. So I'm listening for rhonchi, I'm listening for wheezes, I'm listening for any crackles, anything abnormal which I'm not hearing. We can move on from there to the cardiovascular system, which again is on the chest. Again, I start by inspecting. I'm looking for any heaves, and I can move on to palpating, and I'm going to palpate the valvular areas. So I'm going to start with the pulmonic valve, and you can feel down to the intercostal space, and then move over from there to the pulmonic, down to Erb's point, which should be the 3rd intercostal space. So you do the 2nd intercostal, 2nd, down to 3rd. 4th would be the tricuspid, and then over, you're going to go over to from the 4th to the 5th, and you're going to go mid-clavicular, and that's where you'll feel the tricuspid area, which is the PMI, the point of maximum impulse. And you should be able to palpate there for the pulse. And you can palpate and auscultate and get a pulse rate there by listening for 30 seconds and multiplying it by 2. And again, I'm going to auscultate in that same pattern, listening to those valvular areas. Again, you can make allowances for what they're wearing, how much adipose tissue, how much breast tissue your patient has. I'm sort of doing a quick once over for the camera here, but you make modifications as you need. From there, I'm going to move on to looking at her. And when I'm listening to the cardiovascular system, I'm listening for that nice S1, S2 heart sound. I'm listening for any extra sounds, any S3. I'm listening for any murmurs, any rubs, and I'm not hearing any of those adventitious the heart sounds. So everything is normal there. I can move from there to looking at her extremities. I'm looking and feeling for any edema, which I'm not seeing. I can look at her nail beds and press on those for capillary refill. So I'm seeing that that capillary refill is less than 2 seconds. Her extremities are nice and warm, dry. I can assess for the distribution of hair, the venous pattern, any skin issues. And again, I'm not seeing anything that's a cause for concern. I can move from there to feeling for pulses. So starting with the brachial pulse, and those are nice and strong, even on both sides, to the radial pulse. From there to the popliteal pulse, to the tibial and the dorsal pedis. And she's got nice, strong, even pulses bilaterally in all those spots. From there, we can go ahead and do an assessment of the abdomen. So I'm going to have Sade lay down. And again, I start by inspecting her abdomen. I can also look at her, again, look at her chest here. I see that there's no excavatum, or her chest is a nice even shape. It's not going in or protruding. Her abdomen is flat. I'm looking for any areas where there's vibrations. I'm looking at the venous pattern, distribution of hair, anywhere that the skin might not be intact, scars. I'm not seeing any of that. So with the abdomen, you're going to move from there to auscultating. You don't want to palpate, so this is the one system that's sort of out of order. So I'm going to go ahead and auscultate. I'm going to start in the upper right quadrant and move clockwise, listening for bowel sounds. And I'm hearing what I would describe as normal active bowel sounds. I can hold on that spot until I'm hearing a gurgling, and you're looking for bowel sounds that might be hypoactive, hyperactive. These are all normal active. I'm going to move from there to listening to the arteries. So about 3 centimeters above the umbilicus, I can listen to the aorta. And then down from that on either side, the iliac, excuse me, the renal, and then below that the iliac. And then you could listen to the femoral and palpate the femoral pulse. I'm not going to do that for our purposes. Sade, do you remember the 3 questions I asked you? The 3 words I asked you to remember? I'll have you sit up now.
Baseball, airplane, and grass.
Very good. So there's a intact short-term memory as far as we can tell. At the close of my assessment, I would ask the patient if they had any questions or anything that they wanted to let me know. And that would be the end of the assessment. I'm just going to look at my notes to see what I forgot. Yes, so the one thing I would want to do is percuss the abdomen. So I'm going to have you lay back down. And I would percuss the abdomen by taking my middle finger of one hand and I'm going to strike it with the other hand. And I'm going to do that in the 4 quadrants. And you're hearing for any abnormal sounds from that, hyperresonance, and I'm not hearing those things. You can sit back up for me. Thank you very much. All right, and that concludes my head to toe. Thank you so much. You lay down for me. Now, the other thing I forgot, in addition to percussing, I'm also going to want to palpate the abdomen. So I am going to move again in the 4 quadrants and feel for any tenderness, any masses. I'm asking Sade to let me know if anything feels uncomfortable. That was another thing I forgot. And that's it. Thank you.